Thank you, everyone. Welcome to the Macomb County Community Mental Health Full Board Meeting. And who would like to read our mission statement? Who has it in front of them? They can read it.
I have a copy. I'll volunteer for that.
Thank you.
Macomb County Mental Health, Macomb County Community Mental Health, guided by the values, strength, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Great, thank you. Next is, we need a motion to approve the agenda.
So moved.
So moved.
Motion
Support.
by Sierra Materials, support by Bush. Any questions or comments on the agenda? All in favor signify by saying aye.
Aye.
Opposed? The agenda is adopted. Next is hearing of the public. What is the method that the public can weigh in? Just join our meeting? Dave is joining the meeting. Is that how the public weighs in?
You're on mute, Dave.
Mute.
I know, I'm trying to unmute. I'm multitasking here.
Right.
I will unmute everybody. Believe that's, oh, here we are. Okay, everybody is unmuted.
Okay.
If you would,
Yes, anyone from the public wishing to speak? Anyone from the public? Neither hearing nor seeing anyone, we will move on to approve item number 5, which is approval of the minutes of the regular meeting of the board that was held on March 25 of 2020.
Motion to support. Support.
Lori, I'm
Motion by Lori, was that Lori? And support by Selena?
Yeah.
All right, any questions or comments on the March 25 minutes? All in favor signify by saying aye.
Aye.
Opposed? The minutes are approved. Next is item number 6, approval of the standing committee meeting minutes and recommendations from the program and budget meeting that was held on April 8 of 2020.
So moved. O'Connell.
Motion by O'Connell, support by
Support.
Frears. Any discussion on those minutes? All in favor signify by saying aye.
Aye.
Opposed? Minutes are approved. Next is item number 7A, a request to approve the issuing of short-term contracts for office-based opioid treatment providers for the opioid health home services. That was something we discussed at our program and budget meeting.
Move to approve. Support.
Motion by Bush, support by Burke. Any questions or comments? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is item 7B, a request to approve the proposals for office-based opioid treatment providers for opioid health home services.
Phillips' motion to support, or Phillips' motion.
Support. O'Connell.
They already
Pat made
voted.
the motion. Lori supported. Any discussion? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is the request to approve new computer services for CMH internal files that will be locally stored. Again, that was something we had discussed at the program and budget meeting.
Move to approve.
Motion by Bush, support by Lori. Any questions or comments? All in favor signify by saying aye. Opposed? Motion carries. Next is item number 8, receive and file any correspondence or other information. Is there anything that we need to consider? Dave?
No.
Okay.
I do have, Thomas Cole is with us this evening, if there were any questions about the server purchase.
Oh, okay. Thank you for being here.
You sleepy, Linda?
It's a pleasure.
Forgot. I've been here alone. I've been here alone so long. Who are all you people?
Okay, any other comments? Or that was on the receive and file. Were there any resolutions? There were none that I saw, unless it came in today.
No.
No resolutions, all right. Then, one of our most important items, and that's approving the list of bills.
So moved, Burke.
Motion by Burke,
Support, Fantuzzi.
support by Fantuzzi. Any questions, comments, or discussion on the bills? All in favor signify by saying aye.
Aye.
Opposed? Okay, the bills are paid. Next. Right, next is the management report. Dave?
Oh, good evening, everybody. Want to do things a little bit different tonight. We do have Richard Carpenter with us. We will be formalizing the format, the structure of the financial updates, but Richard was able to join us tonight. So I would like to give part of my time to Richard for that update. And
Good evening.
Hi, Richard.
Just wanted to give a quick overview on some of the results from our FY 2019 final reporting that was finalized in the middle towards the end of March. Just to give an idea of where that year ended, and then also talk about some of the work that has been done at the beginning of this year as we're trying to clean up some of the financial reporting. So I'm looking at the financial status report that we did submit to the state of Michigan. And for the fiscal year ending 2019, for Medicaid, we ended the year with a $6.9 million surplus, which we were able to put into the internal service fund risk reserve, which is good. And for our Healthy Michigan, we ended the year with a almost $3.2 million surplus that we were able to put into the internal service fund risk reserve. So a total contribution of $10.1 million for that year. Some of the reasons for that $10.1 million surplus. First, there was some reporting issues that happened later in the year. And so there's
I have a question about the term. When you say surplus, you're not talking ISF. We had a actual surplus?
We had an
Or
actual revenue greater than expenses.
And that's not ISF.
We put it into the ISF. That's
Okay.
in addition to what was already there.
Thank you. Thank you.
Yes. So some of that surplus had to do with some revenue that was being misreported during the course of the fiscal year, approximately $7 million that was identified. And then we also did have a compliance issue that was identified during 2019, just a little bit more than $2 million. And as a result of that, we were required to remove that $2 million from our Medicaid expenses and report that as general fund expenses. So between those two major issues, that accounts for the majority of that $10 million surplus that we're able to put in. And then, which leads me into kind of the results.
I have a question for you, Richard. When you say there was a compliance issue of $2 million, can you explain that a little bit more?
I'll take that one. I wanted to let you guys know, Stacy Coleman, our Chief Compliance Officer, is on, and you will be getting a more structured, regular report from the Compliance Department going forward. We hope to start that at the next board meeting. But what happened last year is there was a private duty nursing provider who was not appropriately accredited to provide that service, which made all of their Medicaid claims null and void. The services were provided and they were paid for, but we were unable to report them as Medicaid.
Okay.
So we are no longer contracting with that provider. We transitioned all those folks over to other nursing agencies, but we had to settle this up on our financial side. And with Richard's help, that we were actually able to use some general fund dollars to cover that.
So when did that occur? Because I honestly, I don't remember this.
It goes back to December of 17 or
Okay.
18
Okay.
that it started, and then it lingered on. Legal was involved, is involved. We are looking to see legal's involved. I'll leave it at that.
Okay.
And it was reported to the Office of Inspector General at the state. So all the appropriate reporting was done. There was just some loose ends on the finance side that we've now addressed.
Okay.
Richard, I think I heard you say that there was 7 million of unreported revenue. We were aware of 4 million of unreported revenue up till now.
It was the 7.8 million that I had reported to the board previously.
Oh, I'm sorry. I thought
The
you had said.
No,
Go
the 4 million was the previous year issue with the autism services.
Okay.
Last year was 7.8.
Okay. So Richard, what's the total amount we now have in our ISF?
Total balance, ending balance of the internal service fund is $10,931,000.
That's the two that you just reported. There wasn't anything carried over?
Well, we put in about 10.1 million, and we had about $800,000 already in there.
Okay, so it's 10.9. Gotcha.
Correct.
Okay.
Any other questions about the surplus in either Medicaid or Healthy Michigan before I talk about the results of our general fund contract? Hearing none. In our general fund contract, we did end the year with a $900,000 deficit. So we did overspend our general fund contract. Again, the main reason for that overspend was the $2 million compliance issue that we had to move into the general fund. So had we not had that compliance issue, we would have ended the year with approximately a $1 million surplus, some of which we would have been allowed to carry forward into the next year, and some of which we may have had to lapse back to the state.
The word lapse, the word lapse is really a word that I don't like to hear, lapsing money. So I didn't even know that was an option with an agency in our situation. We could think of some way to spend it, I would think.
Yeah, and of course, we avoided that issue in part because of the compliance situation. And of course, we'll be looking at projecting both our revenues and expenses this year much more timely to avoid that type of an issue for 2020.
And just to be clear, you said the general fund ended up with a $900,000 deficit because of the compliance issue. That's before, I thought you said we moved 2 million from.
Yes, correct. That 900,000 deficit was after the 2 million.
We moved it from general fund to Medicaid. So we're carrying forward a $900,000 deficit from 20 to 21.
So we moved expenses from Medicaid to general fund. So it created a $900,000 deficit. We are going to be required to use our unrestricted fund balance. We had to use our unrestricted fund balance to cover that deficit.
In the current fiscal year.
Well, in FY19, we had to use that.
Okay.
Any additional questions about the general fund results? Okay. So transitioning to just talk a little bit of some of the cleanup that we did as part of the reporting that we did for the fiscal year 2019 state reports. We did do a walkthrough of all of the balance sheet items that Macomb CMH had been carrying. And we did do quite a bit of cleanup with the help of Dawn Pratt and Chris Young. So very appreciative of the staff, the finance staff that we had helping us to get, in some instances, some balance sheet items that had been lingering for quite some time, for a couple of years. So we were able to clean all of that up, which is good, because as we start looking at fiscal year 2020 reporting, we've got a clean slate to get started from, which I'm excited about.
Okay.
If the other thing that I want to just mention a little bit, and I think Dave has brought you up to speed, is as we start to transition from 2019 to 2020, the biggest issue on our plate this year is trying to figure out the revenue from the state of Michigan, which has become close to my worst nightmare. Unfortunately, the state gave us rates back in September of 2019. We've been, as a group of PIHPs, we've been working with them ever since our first payment in October, identifying issues that we've had with those payments. Almost every month we get a report back from them that says, oh, well, next month it'll be fixed. So, true to form, my understanding based on our last meeting, which was last week, is that this month the payment's supposed to be fixed. We're supposed to get it tomorrow. And if that's truly the case, then I'll have the information I need to do a good revenue projection for fiscal year 20. I met with the finance team today. We talked about our plan to not only do a projection for the revenue side, but also a full expense projection so that we can identify any budget amendments we would need to request for the remainder of the fiscal year. So that project is underway.
That's in all three accounts? Medicaid, Healthy Michigan, and the state's general fund contribution?
No, the issues for the revenue are specifically the Medicaid and the Healthy Michigan. The state general fund contribution, we do know what that is going to be, and so that's staying consistent.
Okay, and do we know, I recognize the shift arounds, and David's been keeping us posted for some time on the problems we're having with the state in terms of getting both a rate and an actual amount, and the problems they had with people who were counted in past years and paid, and they're claiming shouldn't have been. But so I understand our revenues we're not certain of, but I assume, but we do know what revenues we've actually received. On an actual level, do we have any idea where we are? Are we in deficit in any funds so far? I'm not talking about the accrual, I'm talking about in terms of actual dollars received.
So we do know how much revenue we've been getting. The problem right now is that the amount we've been getting, we know, is lower than what we should have been getting, to the tune of about 4% for the year. So the last I had looked, I think we were close to break even based on what we had actually received versus what our spend rate was looking like. So my hope and my expectation is that once we get the new rates calculated, that we'll be showing a surplus again in 2020, like we saw in 2019.
So
now
in terms of the general fund, we're not expending more than we've received. Actual Medicaid and Healthy Michigan are the same. We expect to do better in terms of revenues once they've made their corrections at the departmental level. Because there are a number of areas where David has suggested we need to do some additional expenditures, which yeah, I think he's right on the areas he's identified, but I'm trying to figure out whether you're telling us, yes, we've got those funds to do it, or no, we don't, or we're hoping we will have the funds to do it, which are three different things.
Right. So, and Dave does continue to ask me that question very frequently. How quickly will I know what the resources I have to deal with? And so, and I feel badly because I sound like a broken record. The expectation is that after tomorrow with the payment, I'll have a better answer for him, other than I think we're going to be okay. I know that COVID-19 is causing us more expenses than we were anticipating, but I need more information from the state before I can give a definitive, yep, we've got this much to play with in terms of revenue greater than our current spend. So.
Yeah, but you're telling us on an accrued basis, and I'm looking on an actual basis. Until I understand why you can't give us any answers on an accrued basis when the revenues are still up in the air. But in terms of actual dollars that we've received, if we write the checks, are they going to clear? Is basically in terms of actual dollars.
Yep. So at this point in time, the last that I was looking, the actual dollars received and the actual dollars going out the door, we were about break even. Knowing that there's more revenue that is going to come in the door, and there's also a delay on the amount of expenses because of the delay between when claims are incurred versus reported to us.
Sure. Okay.
Dave, was there anything else specifically that you wanted to make sure that we covered in the finance update? I think I covered the main topics that were of most interest.
Richard?
You covered the points we had discussed. One sec, Ryan. On the general fund side too, Linda, just so you know, I did temporarily expand our general fund benefit to make sure that people who are coming in without Medicaid don't have any delays in service. And because there was potential barriers at the state level in getting new Medicaid applications processed, and getting our case managers and supports coordinators set up to help people remotely. I didn't want to have any delays in service. So our hope is if they came in without Medicaid, we could use the general fund dollars. They would hopefully, with our efforts, get on Medicaid. It would go retroactive and everything would work out in the end. But we did that as a temporary assistance during this state of emergency as well.
Okay, thank you.
Ryan, you had a question?
Yeah, I have a question for Richard. Richard, when we had our budget in fiscal year 2019, how do we anticipate a $10 million surplus?
No.
How different from the actual result, the $10 million surplus to what we budgeted? Was it a difference of 10 million?
I think it was close to that. I know that when I stepped in, the budget for 2019 was already closed. So I have not done a budget to actual comparison in detail to see where the differences are. But I know that when I was talking to Steve Adair, as they're going through their audit process at the county level, that there were not budget adjustments requested by the previous CFO towards the end of the year. And so I don't believe there was any adjustments made to account for some of the differences that we're seeing.
And what's our yearly operating expenses about?
So we reported, I've got the number that I have right in front of me is we reported about 233 million of expenses to the state last year.
Okay. And can we, to Linda's point, it's not as though that $10 million is not lost. We still have it and we can use it.
Correct. That $10 million, we were allowed to put that into the internal service fund. It actually helps replenish some of the usage that we've had over the past few years. And then we can use that to manage our risk going forward. We do have about another $4.5 million that we can still put into the internal service fund before we max that out. And then we're also allowed to carry forward 7.5% in a Medicaid savings, so about another $14 million. So we have about $20 million of reserves that we can still hold on top of what we already have.
Okay, thank you.
I have a
Thank you.
comment.
Tony, did you have a question?
And I have a comment. This really feels good to me. And thank you very much, David and Richard. You guys are really doing a great job for us.
Thank you. Richard, I have one question. Is there anyone else that has a question before we?
I have a question. More of a comment, and Ryan's comments were right on time. I found, and I think I reacted quickly, I found the word surplus to be something that I wasn't familiar with. Well, first of all, we haven't had extra money ever in like 5 years, but surplus, the ISF is a budget item. I mean, it is something that part of the budget. I mean, it wasn't really a surplus, so
I think she's having connection issues.
Right. She froze.
hello?
Oh, she's back.
Oh, Linda.
Can you hear
Continue.
me? No?
Yes, we can.
Okay. Hello. So I don't have any video, so I'll just say it. So I just thought that was a term that I wasn't familiar with in terms of our budgeting process. I mean, you know, when I first got on the board, yeah, we really did have surplus.
The surplus is the amount that we're able to put into the ISF for if it's on the Medicaid Healthy Michigan side.
Right. Richard, when did you say, or if you already said it, could you repeat, when can we expect to actually see a financial report that we'd be able to review ahead of time and discuss at a meeting, have you present?
So my hope is to have a finance report format available for the May meetings. And I know that, and so that would be for the months through March of 2020 would be the hope to have a report.
Great. All right.
So
Thank
about
you.
a month from now.
Mm-hmm. All right.
Kathy, just one other question. I understand they keep changing how much we receive month to month and how much we're projected. Is the Medicaid per capita rate going up and down and back and forth, or is it just their calculation of what that rate is going to generate? Same thing with Healthy Michigan.
So effective for April 2020, they actually increased the amount we get per capita.
The capitated rate was supposed to go up because they changed the criteria. I understand that. But what I'm asking is the delay in getting our payments right, our revenues right, a result of fluctuations in their determination of the capitated rate or of the calculation of the capitated rate based on the number of Medicaid and Healthy Michigan personnel or clients? You follow me? I mean, is it a multiplication issue, or is it an actual determination of what the rate is? Are they changing or changing or periodically the discussion of what the capitated rate will be, or are they changing what the impact of the capitated rate will be?
They're actually changing what the capitated rate itself will be, not just the impact.
And that's because they're changing criteria as they go along, or what?
That's because when they calculated the rate back in August and September of 2019, they made some assumptions that they found out were erroneous. And so they have to update the rate based on correct assumptions instead of the incorrect assumptions.
So they're still basically adjusting our 2020 rate based on what they did or didn't do in 2019?
Right, because every time that they set our rate and they say we're going to pay, again, let's say $10 for a person, they do that prospectively. So they make some assumptions about what our costs are going to be, and they make some assumptions about how many eligible people we're going to have. And what they did is they made some, I won't say some, they made some bad assumptions based on data that was given to the actuary from the department. And so they had to go back and they had to correct those assumptions and then recalculate the rate.
Okay, and then David, where are we on the adjustments for the numbers based on the ones they say they died that we were paid for?
We just got the notice today that they're not doing the May. They're not holding the funds back from May for they call it the death audit. So that's still in flux as well.
So they haven't charged us yet, but they're saying they may at some point.
Yeah, they could reinstate that.
Gotcha.
Yeah, my understanding is that they know that they're going to take that back. They may not take all of it because they were doing some review. We did, as part of the fiscal year 2019 close, we did accrue that $2 million back. So we have taken that into consideration when we submitted our reports for FY19. So that should not impact our FY20 budget.
Okay. Dave, do you have anything else in your report?
Oh, yeah. Also, I've been getting a lot of questions from board members about what we're making available to our staff during the state of emergency and to the community at large. So I asked Tracy Smith if she would be able to give us some updates on those topics.
Great. Hi, everyone. I will be brief and just give you some highlights. And to summarize, we have amazing staff, if you already don't know that. Some of the things that you've been recently included on is we send out daily email communications with updates, with resources, kind of anything that's changing, just to kind of keep everybody in the loop. And of course, including fun things like the baby picture contest. And I'm sure you all guessed right away, Kathy Vosberg's photo. You could definitely tell as long as you looked at her face, right? So you'll notice that the daily communications you guys were just starting to be included on, they were much more extensive and much more overwhelming in the past, but they're getting more manageable, hopefully, for the staff because things aren't changing quite as quickly. The other things we do, and you all are welcome to join, we have a closed LinkedIn group. The purpose of the group is just to share fun things. On it, you will find the staff have posted pictures of their new home offices, their new coworkers, AKA their kids or dogs or cats, and other just kind of fun facts just to kind of keep everybody in the loop. Other things, I'm calling every single staff member at least once during this process, and I can't stress to you guys how great our staff are. When you call them, they have great attitudes, even though they have their own life, personal circumstances. They are very into doing everything they can do to help our consumers and even the community at large. Some of the other kind of community-based things that we're doing is we are holding live Zoom sessions on various topics for our staff and for the public. This information that I'm sharing is in those daily emails, including the one from today. But to summarize, it's things like how to talk about COVID to your kids, or if you're a clinician, how to take into consideration COVID and how it's impacting your consumer's life structure. We're also trying to reach out to our county partners and the larger public. The way that we're doing that is through our MERG session. If you're not familiar, we actually do a MERG event, and what it is, it's a de-escalation, or there's a second one where it's an evidence-based process where if somebody's impacted by a crisis or crises, We take the group of people through kind of a process in order to help them process what has occurred. Currently, we've held one session for the RNs in the county. If you're not familiar, the Macomb County has a line that people can call and talk and ask questions about COVID and where to go and whatever they're going through. And they have over 60 nurses that are answering this lines, and I'm sure are hearing a lot of horrible things. So we're holding events for those nurses or any of the healthcare workers. We have 6 sessions scheduled that have already started and that are occurring over the next 2 weeks. We're also going to be starting one for the first responders in Macomb County, kind of with the same process. So that is a very brief summary. If you have any questions, I welcome them.
Great. Thank you, Tracy. I appreciate it. I have multiple lists here in front of me, so I'm going to try to just hit on some of the highlights. The CCBHCs, the Certified Community Behavioral Health Centers, we were notified from Michigan, from the department. They're hopeful that Michigan will be one of the expansion states for the $960 million for the CCBHCs, and they were wondering, just verifying our interest and ability to start up October, and we verified that. So it's not official yet, but we are, there's a meeting coming up here where we're going to start planning for that to happen. I mentioned that we'll be formalizing the compliance reports to the board. We will be scheduling the 2 additional board study sessions with Richard on the finance side. We have posted for the CFO position. I have reviewed those applicants and I have whittled it down a bit. And Steve Schmiegel, the CFO for Macomb County, has said that he will go through the ones that I approved to help whittle that down a little bit further and give some opinions to us. So that's in process. Also, Adam has been tracking our phone calls, our phone centers through the managed care operations, formerly Access, as well as now our the crisis line. We're getting good detail about the number of calls, the number of abandoned calls, and how long it takes, how many seconds it takes to get those calls answered. The first shot at those, they're looking good, and he'll have a more detailed packet available for next month's board meeting. From my email with those updates, the Appendix K from the department was just submitted this week. So the 1135 waiver was approved, but the Appendix K is the one that has all the detail about the hazard pay for direct care staff who are working with people who are COVID positive. It increases possibly hours for private duty nursing. It frees up the criteria about who can provide community living supports. And there's a number of things that they're looking at in that area that is yet to be approved by CMS. But we're making plans internally so that we can enact those quickly once they are approved. So stay tuned for that. We did get a couple of grants that will result in budget adjustments that will have to go through the Board of Commissioners process. So I'm working with Phil on that. The CCBHC would be a $2 million grant if we are awarded that. And we're looking at an FCC grant right now that will help cover some of the costs related to the telehealth. And Jim Losey is helping us apply for those dollars as well. At the state level, there was $5 million in general fund that is supposed to be distributed statewide. It's based on the number of COVID positive people in your area. And there you go. And we don't know yet. The state's supposed to be releasing their algorithm on how that will be distributed amongst the regions. So we don't know yet how much of that will be for Macomb County. We have been purchasing a lot of personal protection equipment and making that available to the providers. The state has asked, and they're supposed to be shipping us some PPE, and the emergency services at the Macomb County has also been very helpful. So we do expect additional shipments and ongoing shipments to help us treat the people in the county. And I can't end without echoing what Tracy said about our staff. Just kudos all around. Dealing with some very difficult situations. And every day that goes by, I keep waiting for something horrible. We're managing things very well right now. We are planning for if there was, a critical emergent event, but we have not had to initiate that. We're actually meeting, I think, thanks to Lori Phillips, with our skill building providers about kind of their new normal when things start to be lifted. And then with Richard's help and with this Appendix K to get some funding out to those skill building providers who were kind of the first to close up. So there's a lot going on. I appreciate everything you guys are doing and the questions that I'm getting from the board. And if there's any questions, I'd be happy to entertain those. And I will make an effort, in addition to Tracy's emails, to do some more frequent communication with the board about all of these changes.
David, it's Selena. I do want to say that Christina had a meeting with all the Macomb County providers while they were the outpatient and the hospital providers last week. And, it kind of went exactly how we expected. The hospitals and the freestanding hospitals were not agreeing on what a COVID positive and what you could take. I want to say that Christina and Emma handled it really well. She set up a follow-up meeting. We were able to talk and rectify it. So I want to say the same thing that you are. Your staff are really going beyond what they would normally do in a traditional setting and really trying to help the providers move through this crazy time, because what we're finding is that we don't know who's COVID positive and who's not, who's got a false negative. And so we're basically having to treat everybody like they have it. But I do want to say that your team has been wonderful. I'm getting, feedbacks from all the hospitals that you guys are right on top of things and trying to help us maneuver through these unprecedented times.
Thank you very much. Yeah, I've been in on some of those meetings, and our communication with providers has been very important. We're doing numerous frequent Zoom meetings with our providers. Tracy's calling on our staff to check on them. Quality is making contacts out to all of our provider sites. And we've opened up lines of communication. If they're having, financial problems, Richard and I will be dealing with those with Dawn's help. So yeah, things right now are moving well, and staff are doing really good work from their homes.
Right. Any other questions? All right. Thank you very much for the continued communication. I do sometimes wonder what's going on, and then just about that time an email pops in with some information. I appreciate it. Next is any other possible agenda items that the board members have? I don't see anything. Oh, Nick, are you? No, all right.
Did you want me to?
Oh, yes, please
bring
talk
people up
about
to date on that?
yeah.
As a result, as you know, back in February, the Legislative and Policy Committee had a meeting and approved one resolution with amendments. unfortunately, during the transition of our central staff, the minutes have disappeared. They can't find them. So we've been trying to reconstruct all of that. The one resolution I have, the resolution as I had introduced it, we made a couple of amendments. I remembered some of them off the top of my head. I think the rest had come from David, and so he's reviewing. I sent him my recollections as well as the original amendment, the original resolution. It's not an urgent thing. So what Kathy and I discussed doing, we're probably never going to have the minutes, although we're in the process of trying to recreate who was at the meeting. So if you were at that meeting, please notify
Sandy.
And she's basically canvassing the board members for that purpose. And then I will be in conjunction with David reconstructing as best we can the IMD waiver resolution that we adopted. We'll distribute that to everybody by email as soon as we can, and then we'll put that on the agenda for the next board meeting. So I apologize for the delay. It's just got lost in the shuffle, and Sandy did a great job of trying to reach out to our prior staff people and comb through the computers and everything to see if we could find where it was, and was not successful. So, there were two issues that were dealt with. One is on hold, obviously the breakfast with legislators, since everything's on hold right now as a result of the COVID pandemic. But the resolution will reconstruct as best we can, share it with everybody, and then get everybody's input and take it up before the full board next month.
Right. Thanks, Nick. And I have one last item, and that is, I talked to Sandy about my expense report. I realized I hadn't filed the March one, and she said that very few of us have. So if you have not filed your March, please turn that in to Sandy, and either snail mail it or take a picture or scan it, whatever technology you have to get that to her. And then, of course, we've got another one for April, which I don't think we have any more meetings for the rest of the month, so you could fill out the April meeting after tonight's event. So turn those in, because finance likes to get them on a timely basis so that they're not doing a whole bunch all in 1 month. All right.
Kathy, I wanted to speak, but I didn't. Can you hear me now?
We can, yes.
I was muted. I'm on the Member Services Committee of the association, and I sent an email, but just to remind you that, of course, the June conference has been, it was like a spring, summer, they had moved it to June. It's been canceled, rescheduled to, they're looking at 2 dates in August, although one of the dates I pointed out to them, the 3rd through the 5th, that Tuesday is election day, so that's probably not a good for all the people who are involved in county politics and so forth and other levels. But the other date is August 17th through the 18th, and in Traverse City. And of course, we don't know what the situation will be like then. They will, depending on what the precautions are, they of course will follow them and figure out some way to do it if they're going to go ahead with it. But those are the tentative dates, August 17th, 18th, and 19th.
All right, thank you. Anyone else? Seeing none, a motion. Oh, we need to hear from the public. Is there anyone from the public that would like to address this board?
I unmuted everybody.
Anyone from the public that would like to address this board? We were maybe going to have somebody, but that person's not online, Dave?
No, she didn't call in.
Okay. All right?
Aye.
Last call. Anyone like to address this board? Hearing none, this meeting is adjourned.